Very good evening, everybody. Meeting again in the session of Materia Medica. And up till now, we have finished 11 remedies from the third year syllabus. We have started with the A series and we are up to the Asafoetida today. A very important remedy called to be a gum of sting sand. It is a common entity which we used to use in our kitchen. हिंग आपण जे मराठीत म्हणतो, that is a part and parcel of having medicinal properties and which are very useful in day-to-day practice. So generally this remedy is overlooked many times. No one knows the depth of Asafoetida. Today we're going to learn the depth about this remedy. Before going to the Borix Materia Medica, I want to share 3 important cases in my practice which are having the typical features of Asafoetida. It was very important remedy basically in the deficient milk secretions after gestation. And I have used it many times. I had an occasion because we have a gynec obstetric hospital, and because of which many times the patients never get a sufficient milk. Generally, this happens after LSCS, but many times it happens. There was one patient who was primary delivered normally, and even after a third day, she never had a milk. Very small amount of milk was coming. So they asked, is there any remedy for homeopathy, in homeopathy? And yes, I have given the Asafoetida. And I have never failed with the Asafoetida. I have used Asafoetida 30 potency in repeated doses, at least for a week in such types of patient. And generally used to get results within 2 days. The milk gets very easily secreted after once you give the Asafoetida, and that is my experience. I have given same to that patient, and within a span of 48 hours, the milk secretion was normal. And this happened many times. This is not first time. It has happened many times in my practice. And this is a good remedy to be utilized in such types of cases. So Asafoetida for deficient milk, yes, sure. Second important case, I recollect it was way back in 1998. One of the patient was called to me having the problem. Just a minute. फक्त सांगा चालू झालं. Start. One of the patient who called me that he had an accident and he had a compound fracture, tibia fibula, on left lower extremity. He got operated for that. After operation, the wound was not healing, and doctor told him that it will not going to heal. It is the osteomyelitis which has developed over there. The problem was that it was very painful, and it used to ooze a lot, and discharge were very offensive. So he asked me on telephone, is it possible to treat with homeopathy? And patient was brought to me. Operation was done 6 months back, and there was a wound on left tibia. It is discharging and very offensive discharge. Yes, when I removed the dressing, it was very offensive, thick discharge was there. And he has been under lot of antibiotics and everything. Whenever he used to take antibiotics, the discharge used to become less, offensiveness little bit disappears during the antibiotic course, and again it used to happen. And one important modality which he has explained, that it pains a lot, but whenever I sleep at night, it tremendously pains. That was his problem. Whenever he used to sleep, he used to get more pains at night. And that was troubling him. That was the basic problem because of which he came for the homeopathic treatment. When I look towards the case, it found to be a really offensive discharge from the wound. That brings me, and second important modality, aggravation at night, bring me to consider the Asafoetida in the case. Asafoetida has the periosteal, osteal necrosis, degeneration. It has the remedy which is very defecting, syphilitic remedy, purely syphilitic remedy. So it used to penetrate, but most important modality is that it used to be produce very offensive discharge and aggravation at night. So I have started him, I have asked him to put a calendula dressing daily, calendula mother tincture directly on the wound by after cleaning and putting the gauze over there, putting calendula mother tincture over there, and I have started him on the Asafoetida 200. He used to do a dressing at his home. After a period of nearly 10 or 11 day, he called me, doctor, there is something I'm observing, that a part which is protruding from it. So I want to come to you. When he was brought to me, and when I opened the wound, there was a particle of the fractured tibia, which was completely blackened, and it was there. I just, with the help of forceps, removed that, and then whole story was finished. Then that particle was removed, and the discharge was stopped, and within span of 15 days, it healed completely, and thereafter, no more recurrence happened. This is a wonderful remedy in such types of osteomyelitic cases where the degeneration at the periosteal osteal region causing a damage, producing a discharge, very offensive discharge, aggravation at night, the pains and swelling gets aggravated at night. This is wonderful remedy to be think of. So that was the second case, which was very nicely settled with the Asafoetida. And third case was a very young girl, in fact, just married 6 months back, not even 6 months back, 5, 6 months back, and she was brought to me. And she was there with her mother-in-law, and mother-in-law told the history because she was shy, and she was having a tremendous acid peptic trouble. She used to get a severe burning retrosternally, and she used to get lot of irritations. And she told one important sentence: whenever she gets excited, she used to develop this problem. Either she develops irritability, whenever she becomes irritable because of that, she starts getting the irritations, and there is a problem in the chest, and she feels that something is coming out, nothing comes out, but there is a severe spasm which happens to be there. And if it persists for longer time of duration, she used to get faint. Fainting happens to be there. Then her mother-in-law told one thing: doctor, this is just a private thing which she has told, that whenever they have the relations at night, next day she used to get this problem. So her problem used to get aggravated by coition. That was very typical with this. So, very excitable lady, hysterical lady, who used to faint by slightest emotions, emotional stress, gets irritable, getting hysterical spasms, not getting completely the irritations properly, as if something is obstructed in the GI tract, and used to get faint. Globus hystericus, where this is called as the globus hystericus. We have many remedies in our homeopathic mater medica. We have valeriana, we have moscus, So many remedies are there in our homeopathic Mater Medica having similar types of feature, but this is very typical that coition aggravates this. This was typical with the Asafoetida. So I have given Asafoetida again to this lady, and I have started again with the 200 3 times a day for 4 days and asked to tell me what happens. After a week, she returned, and after starting Asafoetida, next day she started feeling better, and thereafter she never had a problem. Then I asked that whether you had relations, and she said yes, 2 times we had, but I never got such a problem thereafter. A very, very important remedy for the hysterical ladies who are sensitive, disturbed, very excited, easily gets excited, going into the hysterical spasms. This remedy is a wonderful remedy in such types of patients. And most important modality is that the hysterical spasms generally gets aggravated after coition. So this remedy is a very important remedy in our Mater Medica. Keep it in your mind. The miasmatic background is always syphilitic, purely syphilitic. So we'll start it from Borix Mater Medica. We'll learn the sentence by sentence. Asafoetida, gum of sting sand. The flatulence and spasmodic contraction of the stomach and esophagus with reverse peristalsis, that is the reflux esophagitis, that is very important, are the important marked symptom. In its selection, its relation to the hysterical and hypochondriacal patients must be borne in mind. Hypochondriacal means those who feels that they are having a big disease and they are continuously thinking about their disease are the hypochondriacal persons. Besides these superficial symptoms, it has been found to affect favorably deep ulcerations. Underline this. Typical parameters of syphilitic miasm: deep ulcerations, caries of bones, especially the syphilitic organism, in the syphilitic organism. Here the extreme sensitiveness and terrible throbbing, nightly pains guides to its use. So see, night pains is the typical aggravation modality of the syphilitic miasm. Bony erosions, bony affection, again syphilitic. So this remedy has very specific action or very specific understanding regarding the syphilitic focus. Head, irritable, complaints of her troubles, sensitive, head is sensitive, boring above the eyebrows, pressive pain from within outward. In specifically in forehead, there is pressive pain as if it is coming out, it is just getting burst. Generally, this happens whenever the frontal sinusitis happens. Again, a bony affection, frontal sinusitis, bony affection, you are going to get Asafoetida. When it is more maxillary, you can think about the Calibichromicum having the similar action. If it is severely busting, very severe busting in the maxillary bones, what is the remedy? Anyone? Very maxilla, which is very severely painful. Which is the remedy? Maxillary bone, maxillary spasm, maxillary neuralgia, very important remedy.
Hello, sir.
Hmm?
Hekla lava.
Correct. It is Hekla lava. Very correct. It is Hekla lava. Typical action on specifically maxillary bones, mandibles, basically maxillary bones. Bursting sensation. Eyes, orbital neuralgia, better by pressure and rest, iritis and intraocular inflammation. See, in eyes, you get more syphilitic features over there. There is intraocular inflammations with boring, throbbing pains at night, stitches under the left frontal eminence, boring pains in and around eyes, syphilitic iritis. See, miasm comes through and through in this remedy. The syphilitic iritis, iris becomes degenerated. Superficial corneal ulcers with digging pains worse at night. So again, a remedy for keratitis, having directly a corneal ulcer. Ears offensive otorrhea. Discharge is again offensive. With boring pains in mustard bone. Mustard disease with pain in temporal region with pushing out sensation as if something is coming out from ear. That is very typical. Another specific remedy for mustarditis. Anyone? Any idea? Most common.
Calimue.
Which one?
Capsicum, sir.
Calimue.
Correct. Capsicum. It is capsicum. Very clear. Capsicum is having very specific action on mastoids. Syphilitic iritis, superficial corneal ulcers with digging pains, worse at night. Ears, offensive otorrhea with boring pains in mustard bone, mustard disease with pain in temporal region with pushing out sensation, offensive purulent discharge. Nodes, the syphilitic oozina. Say again, syphilitic oozina with very offensive purulent discharge, caries of nasal bones like aurum, like calibricomicum. These are the remedies purely syphilitic, having action on nasal bones. The throat, globus hystericus. Balls rises in the throat. It comes as if from the nose, from the throat. Sensation as if peristaltic motion is were reversed and esophagus driven into the stomach to throat. It is sensation as if hiatus hernia, features of hiatus hernia, which are quite common with this remedy. Stomach, there is great difficulty in bringing up wind. This is one more feature which patient used to tell you in their own language. Generally, Marathi people, they talks like this. डॉक्टर वरचा श्वास वर खालचा श्वास खाली असं राहतो असं पार पॅक होऊन जाते छाती. This is the thing with which they talk, as if they cannot breathe in or breathe out, and that type of obstruction they feels. Flatulence and regurgitation of liquid, hysterical flatulence, great distension, sensation of emptiness and weakness with distension and beating in stomach and abdomen, forcible eructation of the gas, pulsations in the pit of stomach, violent gastralgia, cutting and burning in stomach and region of diaphragm, gurgling and rolling of the wind which escapes afterwards with loud and difficult eructation. These are the people who used to show you that how they get the eructation, and this you can observe. There are many remedies. Raphanus is one more remedy where you can get such types of hysterical globus hystericus. You get that feature in Raphanus also. But here the specific few things are there. Most important thing is that the patient complains that there is severe flatulence and all those things, and along with that, patient has nightly pains more commonly. Second thing, many times this patient, whenever has this, goes and faints. That is another feature which is present with the Asafoetida. Then female, the mammy turgid with milk in unimpregnated. There is contradictory features. These are very important. Those who are unmarried having the milk secretion, this is one remedy to be considered. Those who are not pregnant having the milk secretion, again having the this remedy is one important remedy. And specifically deficient milk with oversensitiveness, deficient milk in the pregnant ladies, that is another feature which you can get in this remedy. Rectum, distended gripping with hunger, obstinate constipation, pain in perineum as if something dull pressed out. So there is severe pain in perineum, something is dull pressing out. Diarrhea, extremely offensive with meteorism. Meteorism means there is a distended feeling in the intestine, and diarrhea with regurgitation of the food. There is a diarrhea at the same time regurgitation of the food. Both things which you can observe in this because of reverse peristalsis which happens to be there. Chest complaints, spasmodic tightness as if lungs could not be fully expanded. And this is the thing which they talks in such a sense, that they are not able to breathe properly or breathe in or breathe out. It is as if the respiration is getting obstructed. Palpitation more like a tremor. So there is a palpitation, it looks more like a tremor. Tremors are coming. Bones, darting pain and caries in bones. Periosteum painful, swollen, enlarged. Ulcers affecting bones, thin ichorous pus. So all those features are very suggestive of osteomyelitis. Osteomyelitis, whenever is there, you must think about syphilitic remedies only. You must think about Auromate, you must think about the Cipilinum, you must think about the Mercsol, you must think about the Hecla lava. These are the very specific syphilitic remedies which you have to think in such types of cases. Asafoetida is one of them. Skin, there is itching, better by scratching. Ulcers painful on edges. Suppressed skin eruptions or suppressed skin symptoms produce nervous disorder. Nerve disorders are very common. These are the persons who have a nervous diathesis also. They are very sensitive, and on the tip of their nerves, they are reacting very fast. That is another feature which one should not forget, and it is directly having a relation from suppressed skin eruption. It leads to the neuralgias or nerve tendencies, that is of the Asafoetida. If the disease goes from skin and it enters into the brain producing epilepsy, you must think about the ginkgomate or cupromate. Ginkgum on priority basis. Modalities, worse at night, that is typical syphilitic modality. Then from touch, left side during rest. So this is left-sided remedy, more strongly left-sided remedy. Aggravation by warm applications. Better in open air, better from motion, better by pressure. So general modalities very specific with this remedy. Relationship, it antidotes the China and Mercurius. Compare Moschus, China, Mercurius, and Aurum, out of which Moschus is very specific hysterical remedy. So hysteria of Moschus should be compared with this remedy, and rest of the three remedies in China, the GI features should be compared with this remedy. Then in case of Mercurius and Aurum, basically these are syphilitic remedies which you have to compare with this, because both of the remedies are having the similar type of actions, all are syphilitic. So this is a remedy. Dose which he has mentioned is second to sixth potency, but I never goes with the Boric regarding this. Now I used to use generally it in low potency 30 or 200 more commonly. Very occasionally I have used it in the 1M potency. This remedy is generally very deep acting. 20 to 40 days action is there of this remedy. So this is a wonderful remedy to be think of. Dr. Shubhangi, she has asked one question, neuralgia after the herpes, is it neuralgia after herpes? I used to think of more commonly of hypericum always. Hypericum is best remedy to be considered in such types of cases. Asafoetida 30, you can repeat it tedious, yes, sir. Because it is, you can repeat for at least for 3-4 days or for a week, and it requires little bit repetitions. It is not remedy to be given 1 or 2 shots. Give it, at least repeat it for a week. So this is a very important remedy from our Mathemedica. We have finished. Tomorrow we're going to finish A series from third year syllabus, and most important remedy is the Aurum Metallicum. So Aurum, I think it might require 1 or 2 lectures. I don't know. But it is one of the big polycrest one must learn by heart, and many patients of Aurum we used to get in our day-to-day practice. My suggestion to all of you, there I have taken lecture on the Aurum group. It is there uploaded on YouTube. Go through that. There I have discussed, I think so, Aurum from the soul of the remedies. at that time. It's a big way back. Let us learn Materia Medica. In that playlist, you will going to get that Aurum group. So go through that also. That will give you good understanding about Aurum. And tomorrow we're going to learn it from the Allen's keynotes. So that's all for today. If any query is there, we have a chat. Otherwise, we'll conclude. So thank you, everyone. We'll meet tomorrow with both the sessions. Good night.
Thank you, sir. Good night.
Good night.